What's up, guys? Welcome to our first podcast for Optimal Function. I'm Dr. Craig Banks. I'm here with my cousin and great friend, Dr. Jim Morgenstern.
How's it going, guys? Welcome to the show.
All right, so since this is our first episode, we're going to try to talk a little bit about, what we're doing in this show, what our goals are going forward, maybe give a little bit of an introduction about our background. So, first and foremost, I think, us both being chiropractors, we want to talk about health and wellness. That's going to be a big topic, of course. We're going to talk about chiropractic, and we're both into fitness quite a bit. We've been for a very long time, so we're going to talk a lot about fitness, strength training, injury prevention, rehab, mobility. Dr. Jim's a mobility expert, nutrition, some mindset stuff, some neurology, and some little biohacks that everybody can use to perform at their best, because I think optimally, no pun intended, optimally, I think that's what we all want. We want to be able to do our best, perform our best, and work with what we have with our bodies and make it an absolute pinnacle of success for what we want to do overall.
Well said. I mean, I feel like the array of topics that we can cover over the next couple of months is endless, and I hope that it's entertaining to you guys, but it's also informational. On the daily, I know there's so many great conversations that come up in the office, and with the presence of social media that we both have, there's never a dull moment where someone doesn't have a great question online. So, each week we're going to have a segment that's, Ask the Docs, and there's things that we would like to provide to you guys, not only through the audio, but also through video. So we'll have different links to take you throughout the show and reference back to, let's say, YouTube, for example. And you can follow the videos along and hopefully find some relief at home or pass it along to somebody who's in need too. So hope you guys enjoyed, and please, throughout the weeks, keep the feedback coming, because that'll help us do a better job at what we're trying to obtain.
Yeah, absolutely. We want to interact with you guys as our audience. One of the cool things about social media and video now is, in my practice, I can see, a couple hundred people a week. Dr. Jim can see a couple hundred people a week, but now we can reach people all over the world and be able to help them. And I know that was something that one of my mentors said, when he went into consulting, he went into chiropractic consulting, he said, I can help teach other doctors how to make their patients better. So his reach became exponential. And we're kind of doing that same thing with this. Even though we're not teaching other doctors necessarily here, we're still making our reach more exponential. And that's cool. I think that's an amazing thing. If I'm helping somebody that's in Australia, for example, perform better and feel better in the gym, feel better at home, I think that's an awesome thing.
There was a great quote from Muhammad Ali, and I think it's something that stuck with me, many, many years ago during school. It actually came up on a Facebook memory, and I'll share it with you guys. Service to others is the rent you pay for room here on earth. And I feel like every day that we get a chance to touch someone in the office and help them feel better and move better, or whatever it is that their goal is, this is just one more platform that we can do that for you guys. So just remember that this does mean a lot for us, and I hope you guys enjoy every bit of it.
That's awesome. So I think what we were going to do is introduce ourselves a little bit as far as our background. Dr. Jim, I'm going to have you go ahead and go first.
Cool, brother. So first of all, guys, Craig and I are family. We're cousins, and my dad actually was a chiropractor. He still is, back from the 70s. So this runs back many, many, many years. I was obviously born into a chiropractic family, and this is all that I know is the health, the wellness, the fitness industry. I was born into it, and then through the years and through my story here, I'll tell you, I made it my own through the help of this guy next to me here too. So. Like I said, my dad went to Palmer College of Chiropractic up at the Fountainhead over in Davenport, Iowa. And, growing up in a family where our medicine cabinet, quote unquote, it was actually a vitamin cabinet. We didn't have, Advil, Tylenol, those types of things. We had vitamins and chewable vitamins as a kid, and then as we got older, we had a whole array of things that we could do on the daily that helped us grow. I mean, I don't remember really getting sick much as a kid, and I was getting adjusted every other Friday when we'd see my dad, and just growing up in that where that's what we chose as our means of staying healthy and getting healthy as we grew. And As far as my particular journey, my dad had always, hoped that I went into the field where we were helping people. And, but, for any of you out there who have parents who kind of maybe try to push and guide you in one direction, I had to let chiropractic find me and speak to me in a way that made me passionate, just like my dad had found his passion, and just like Craig had found his passion, and he'll share that with you too. I'll be very honest with you. Going up through high school and stuff, I don't know that was yet my vision. It was more or less when I think I got a chance to actually step into a chiropractic clinic and put hands on people to help them, not necessarily yet as a chiropractor, but helping as an assistant, and seeing some of the really cool changes that these folks were getting, including in your office, Craig. When I was in college, people were getting better without having to take pain meds or to go through surgeries. Yes, of course, there's some folks who maybe they had a really, really bad injury that something needed to be intervened in that extreme. But for the majority of folks that were coming in the door, they were getting better through literally someone putting their hands on them. And it's so powerful. So that spoke to me and really spiked my interest. So, I attended Kent State University for my undergrad, got a BS in biology there, and basically just little by little started to aim my focus on, at that time it was called pre-med, but it was a pre-chiropractic focus to get me to Palmer College of Chiropractic, but the Florida campus. So, obviously everybody always jokes, did you want to go out to, cornfields or beaches? And for me, growing up in the Midwest, I always wanted to see what the South was all about. So headed down to Palmer College of Chiropractic in Florida, which was in Port Orange, Florida, and just on a campus visit, it just took me right in. And so a few months later, after graduating from Kent in '09, that summer moved to Florida and started right into school. And that was just the start of something that I just can't believe that I can't see myself doing anything else really. So the curriculum there, for anybody who's looking to go to chiropractic school, really look at all the schools, but Palmer is the Harvard equivalent of chiropractic school. So the curriculum there, I really feel like is top notch, and it helped kind of sculpt me into what I am today. So fast forwarding, obviously, going into clinicals and stuff like that, just every day you saw cool success stories, miracles happening, so to speak, on the table. And like I said, there was no intervention of drugs or surgeries, or, other than just somebody getting their hands, on someone and working and helping them out. So graduated from Palmer College of Chiropractic in September of 2012, moved back home, did a couple months of work alongside Dr. Banks here. And that summer was so much fun. We had so much great times working with athletes, and that's where things started to turn into, this is it. This is real life. We're working, as a doctor, as a physician in real life. And it was a great experience. And then, worked at a couple places locally here in Northeast Ohio, and then opened up my own place in 2015. And it's a primarily a great blend of athletes, families, and then now kids. There's a lot of kids that come in, and parents want to start them young with getting them, healthy right off the bat. So obviously include a lot of nutrition, wellness. Mobility is one of my favorite things to teach. For those of you who follow me on social media, I love teaching through visual, and then as well as thank God for Instagram, Facebook, YouTube, because we can film a little 5-minute video and put it out there. And it's always nice getting those little, hey doc, thanks for fixing, that video up. It really helped me out, whether it was something for the hips, the shoulders, posture, back pain, neck pain, you name it. So we want this, to be an extension of our individual outlets. We want to make this, a gelling of all of our, expertises, and present that to you guys on the regular, because I don't have to think about it. This is just stuff that we're passionate about. So,
Right.
I kind of went off on a little bit there, but, chiropractic is never a 2-second explanation how it's, reached me. And I love it. So hopefully you can share your part, and this can make a lot more sense. Yeah, I'm running on here, but
No, you're
it's
good.
exciting.
You're good. And I totally agree. It's always funny because people will ask me a question, and maybe they're at the gym or whatever, and they always apologize. They say, "Oh,
Yeah.
I'm so sorry. I know you probably don't want to do work while you're not at work." And I try to explain to them, when you're a chiropractor, it doesn't shut off.
Nope.
It's 24 hours a day. It's a lifestyle. It's what we live, breathe, eat, sleep, you name it. That is what we do. So we never feel bad taking time to stop and help somebody, or speak on what somebody can do to improve and help themselves get better, because it's so deeply ingrained. And I don't know that many professions get to have that experience. I mean, I'm sure there are some, but nothing that I can imagine as deeply as chiropractic just runs through the blood.
One more thing too is it's just someone asks like, hey, who do you think could benefit from chiropractic? I get that all the time. Do you think my neighbor could, or do you think, my daughter could, my son could? Every person that owns a spine could benefit from some type of, whether it's just once a month or every couple months, some type of adjustment to help realign their bodies, take pressure off the nervous system, and let their body function more optimally, which is the title of our podcast. And that's, it's like you said, it's ingrained.
Yeah, it's by no coincidence that that's the title of our show here. So my background too, growing up, Jim's dad was a second cousin to me, so he was my mom's first cousin, so he was a little bit older than me, and I didn't know a ton about chiropractic, and I knew that as early as fifth grade I wanted to be a physician, and at first it was I wanted to be a cardiac surgeon, and then later I wanted to do neurosurgery. And the reason I wanted to do neurosurgery, it's kind of funny, but I felt, this is bad, but I was a little bit arrogant at the time, and I thought I was pretty smart, and I said, okay, the smartest people in the world are either rocket scientists or brain surgeons, and I didn't really want to go into rockets. So I wanted to be a brain surgeon, and that was my goal. I was accepted into med school here locally. It was a combined BS MD program, and my plan was to go in and be a neurosurgeon. And at one point, we had to interview people in the field that we wanted to get into. And I had 3 separate neurosurgeons tell me that they would not do it over again. They were very discouraged with the field. They were very discouraged with their particular satisfaction rates, their patient satisfaction rates. And that was a turnoff to me. Malpractice was high, costs were high, everybody was joining up hospitals, so they really were getting told what to do. And the funny thing was, I said, if you think you're going to go into neurosurgery and do brain surgery, think again, because 90% of your stuff is going to be spine, and it's going to be people with chronic low back pain, and you're going to try to fix them, and you're going to get less than 50% of those people better by doing the surgery you're going to offer. So
incredible.
I ended up switching to chiropractic a little bit sight unseen. I knew of Jim's dad from family, but we really hadn't interacted that much. And what I did know was that he had a fantastic patient base. His patients absolutely loved him. He was a bodybuilder, which I thought was cool, because ever since I saw Commando on the cover of TV Guide when I was young, I wanted to do some sort of bodybuilding. I wanted to look like Arnold, like every other kid does, I think. So when I saw that he, A, had a great practice, B, his patients loved him, C, he made his own hours, I was like, wow, I really have to look into this. And when he first adjusted me, it was because I was bowling. And when I would bowl and go to release, my hand would go numb. And with two adjustments, it's never happened again, not one time in my life. And
That's awesome.
He found a little spot in my neck. We actually took some x-rays, and my C6 was really out of place. And I have a little bit of wear and tear there now still, but honestly, I've never had another radicular pain down that arm ever since I was 19 years old. And so switching, I think, was just an absolute blessing for me. I could not consider anything else. I'd maybe go own a casino in Las Vegas or something. I can maybe switch to that, but beyond that,
Still got time for that.
I could never see myself doing anything other than chiropractic. I also went to Palmer. I did happen to go to the cornfields of Iowa, which it's really not that cornfieldy. It's right in Davenport in the Quad Cities, and there's a population of like 400, 500,000, something like that.
Is there a lot of breweries there?
There are a lot of breweries. I actually worked at one. It was pretty phenomenal. But I really enjoyed being out there. I learned a lot. Florida was not an option. They built Florida while I was in Iowa.
So I think it was 2001 when they started building Florida.
Yeah, so I went 99 to 03, so I kind of missed out on the ability to be in Florida. So, when I got back, I've been in practice for 16 years at my office, Pinnacle Chiropractic. I also did a little bit of an internship, which I did with your dad, and saw some of the things that he saw and the patients that he was getting better, and just that hands-on stuff, and really seeing what you don't get in school, because in school it's kind of a manufactured thing. You see staff and you see people who have been going to the clinic all the time. You don't see a baby coming in after a massive vaccine reaction, and then you get adjusted, and then that kid's swelling goes down, or whatever. You don't see people coming in who have been in a 50-mile-an-hour car accident who broke their leg and in the meantime screwed up their neck, screwed up their back, and they're having numbness, tingling, or loss of function, and then chiropractic getting that better. So it only reinforced that chiropractic was indeed what I wanted to do. And I took a little bit more of a sports oriented route once I got out of college, and I did training in rehabilitation and sports chiropractic. So I'm a sports chiropractor, and I've been fortunate to work with a lot of crazy names, some pro athletes, a lot of pro bodybuilders, and so forth. And it's just become my passion. So it's what I do, what I live every day. Um, and I think one of the things that sets both you and I apart from some of the other doctors treating in the fitness world is we've both been there. So I have been bodybuilding since 2004. I played rugby while I was at Palmer, which is as pro as you can get in the United States. So my background was there. I wrestled in college. I wrestled in high school, played football in high school, and I've been an athlete my whole life. And even still, I use bodybuilding to allow me to get that competitive juice flowing, if you will. So, and I know, Jim, you've done some.
Yeah. So nowadays it's a lot of. So I did not as many bodybuilding shows as you, but I did a few, more or less to make sure that I could understand what an athlete would be called upon to do in that prep. So did a few shows back in '07, and then more or less, just trained with this guy here. Did a lot of bodybuilding work as pretty much like a training partner. You were the one that kind of went out and, as you guys can see here on the video, he's a lot larger than I am. I'm more of the compact, and actually nowadays I'm doing more of the running, the rowing, the cardio part of it. So it's nice to be able to have that as kind of not the word expertise, but more or less like I enjoy that because it was something that I struggled with for a really long time. Nobody likes running except people who are really, really good at running. Most bodybuilders don't like to do any cardio. No. So it took years for me to really get that endurance part of my training to go up. So in 2012, when I moved home from chiropractic school, I really enjoyed starting CrossFit up here in Northeast Ohio. So did that for a while, and then now that is a huge part of my practice is CrossFitters and people in the fitness industry. They just want to take care of themselves. They're looking for natural ways to do so. So it's easy for us to work on that because that's what we've lived and enjoyed doing. So I think that was a good segue into to that as well.
Yeah, I know that, while we'll see anybody, I'll see a 70-year-old grandma, and I'll see the car accident patients and the work injury patients. What my passion is still sports. And I enjoy the fact that most of those people, they come into our office and they want to get well.
Exactly.
And, one of the people we'll eventually have in our show is one of my best friends, Dr. Tim Coe, and he's a pain management doctor. And this is not to be said across the board for every pain management person or anything, any pain management patient, but sometimes the patients that he sees, they're really looking for a medication. They're looking for a fix that is going to get them out of pain. And while I can absolutely 100% appreciate that, our patients want to get well. And there's a difference between not being in pain and being well. So that's it just makes practice a little bit easier, I think. I know at the end of the day, I can come home and be a little bit more satisfied, whereas sometimes Tim's like, oh, yeah, today was a rough one.
Exactly.
But he'll talk when he gets on the show, but he really tries to guide people away from that medication now. Of course, we've got the opioid crisis in the United States, and it hits home here in Ohio quite a bit. So it's nice to be able to offer that natural alternative to the people who are in pain, and hopefully we can continue to curb that. I know that the government has recently really recommended chiropractic as an alternative to pain medication.
Yep. We need to get those research articles and be able to have those for you guys on the website and on the blog too. So they're just being released almost weekly right now. So want to make sure we have the stats to share with you. But yes, one more win for chiropractic there as far as being a natural alternative to the opioids.